Hey, it's Dr. Modi with Gastro Office. Today I want to talk about gluten as well as celiac disease. Now, gluten, I'm sure you've seen it in some capacity, whether it's a family member or a friend say that they're gluten intolerant or they went gluten free and they feel really good. Gluten is a type of protein that is in wheat, barley, and rye. So a lot of different foods like breads, baked goods, pastas, cereal, even beer. And so, when you have something called celiac disease, that is a immune response to gluten. Your body does not, it kind of rejects that protein and it results in inflammation, particularly in the GI tract, specifically in the small intestine. And so the small intestine is really important because it helps with gathering all the nutrients from the food we take in. And so the way that we actually test for celiac disease is you can do some simple blood work, whether it's a GI doctor or a primary doctor. But the gold standard to diagnose celiac disease is actually biopsies of your small intestine at time of upper endoscopy. So you would be sleeping for that exam, and with a camera, we can look at your esophagus, your stomach, and in the case of celiac disease, especially your small intestine. And if we see a lot of what we call villus blunting, or just looks like the small bowel is inflamed and it's not really capturing a lot of nutrients the way it should, this is going to show on our biopsies as well when we look under the microscope. Now, why celiac disease is so important is that it's actually very treatable. If you avoid gluten completely, within 6 months, especially if you have no refractory cases or very challenging case of celiac disease, you can generally get pretty, normal healing of your small intestine. Some patients have nutritional deficiencies, including iron, vitamin B12, folate, copper, and zinc. So we'll get some baseline labs, and a lot of those will improve with time. If not, we will provide supplementation as well. So I think the important thing, though, is that some people don't truly have celiac disease. They have something called gluten intolerance. What that means is that gluten intolerance is essentially that when you have gluten, your body does not like it. It does not take to it, but there is no mucosal damage or inflammation that is seen on biopsy or at time of endoscopy. So those patients may say, hey, doc, you know what? I really don't feel good when I have gluten. And I think, my response to those patients is I think it's great that you found a trigger for your symptoms, and it's okay to avoid gluten. But if you do want to enjoy that piece of pizza, or if you want to, enjoy that beer or whatever it may be, pasta, you can do so without knowing that you're going to cause inflammation or risk to your GI system. Now, you may not feel great afterwards, but that there's a key difference between the celiac disease patients who have true biopsy-proven gluten intolerance versus someone who just has gluten intolerance and is just symptomatic. Now, the last thing I would mention here is that the reason that we want to be pretty strict with our celiac patients is there's a little, increased risk over the general population for small bowel cancers. Now, that's not something to scare my celiac patients away with, because once you have the disease in remission and you're, eating a gluten-free diet, it can definitely reduce that risk significantly. But that's the big thing. And the other thing is with celiac disease is that there's a genetic component to all of this. And I would argue that, about 10% of first-degree relatives, whether it's siblings or your kids, may have that risk. And so getting them tested is not a bad idea as well. And so next time you go to whether it's Trader Joe's or, whatever your grocery store is, you can look for gluten-free foods, and you'll see that it's actually quite expensive to eat gluten-free as well. So it's not something I would take lightly in terms of, kind of avoiding it unless you really do feel like, symptoms are worse.